What happens during labor and vaginal birth? Birth is a journey with different stages. Understanding what will happen during labor and birth will help you feel confident to make informed decisions about your care. Labor has 3 stages. Stage 1. This has 2 parts. The first part is early or latent labor as your body prepares for birth. You start having contractions and your cervix begins to soften, shorten and open. This can take a long time and varies greatly between women. The second part, known as established or active labor, begins when your contractions become regular, approximately every 2 to 3 minutes, lasting 45 to 60 seconds, and your cervix has shortened and opened to 3 to 4 centimeters. Active labor continues until your cervix opens fully to about 10 centimeters. This can take 6 to 12 hours, sometimes shorter or longer. Stage 2 is when your cervix is fully open and is known as the pushing stage. This stage can last an hour or more before your baby is born. It is common to have some vaginal tearing during birth. You could explore perineal massage while pregnant to reduce the chance of this occurring. Most tears are repaired and heal quickly without any problems. Stage 1 and 2 may be shorter if this isn't your first labor and can become quicker the more babies you have. Stage 3 is from the birth of your baby until you birth your placenta. There are 2 options to think about. Physiological. You birth your placenta without any medication and push your placenta out yourself. This can happen up to an hour after birth, while you have skin-to-skin and bond with your baby. Active management. This may be recommended if there is a medical need for it to happen quicker, usually within 30 minutes of your baby being born. An injection is given into your thigh, and then a doctor or midwife will gently pull on the cord to remove the placenta. Sometimes the medication used may make you feel a little sick. Following the birth of the placenta, if you need any stitches, these can be done while you continue skin-to-skin and getting to know your baby. You will be offered pain relief while having your stitches. If during labor or while pushing there are concerns about you or your baby's well-being, or if birth has slowed down, we may recommend an assisted or cesarean birth. For an assisted birth, a doctor can use either forceps or a ventouse, often called a kiwi, to help guide your baby out as you push. Forceps sit around your baby's head. A ventouse is a suction cup that is placed on the top of your baby's head. The doctors will recommend the method that is safest for your birth. Both methods may leave a mark or bruise on baby's head that usually disappears within a couple of days, and there is an increased risk of jaundice. Serious injury to the baby is very rare. It may be recommended to have a cut, called an episiotomy, to your perineum during an assisted birth. An assisted birth can increase your risk of larger tears and heavier bleeding. Find out more about assisted births in our What Happens in Theatre video. However you give birth to your baby, a midwife will support you as much as you want throughout and after the birth to bond and feed your baby. You can also watch our other videos to find out more about birth positions, the pain relief options available, and the different places you can give birth.